Hello, everyone. I'd like to welcome you to today's virtual event, Accelerate Vaccine Distribution for State and Local Governments. Presenting for us today, we have Andy Pitman, Director for HHS Strategy from Microsoft, Peter Lane, VP for Client Engagement from Mazik Global, and Amy Leffler, Engagement Manager for the Public Sector from Mazik Global. I'd like to go through our agenda real quick. We'll have some welcome and introductions, which we covered, the intersection of the pandemic and cloud-based technology. Then we'll go through the key components for successful vaccine administration. We'll have a VaccineFlow demo, and then we'll have time at the end for questions and answers. I'd now like to turn the floor over to Andy Pitman. Andy, over to you.
Thank you, Peggy. Hello, everyone. I'm Andy Pitman. My responsibility here at Microsoft is our state and local government health and human services strategy. And on behalf of Mazik and my Microsoft colleagues, thank you for attending today's webinar. You don't need me to tell you that COVID induced a lot of change and unexpected government demands. Microsoft and our partners like Mazik quickly mobilized to address these demands, especially helping governments operate remotely early in the pandemic, doing things like Microsoft Teams, which we're using today, and virtual desktop. But at the same time we were fulfilling those urgent demands, we laid out a timeline, like you see here, of not only immediate needs, but also what we expected might be required or helpful over time. This chart reflects that timeline. And of course, we're not clairvoyant, and what you see in the timeline doesn't exactly match what we originally forecast. Rather, our COVID response perspective has evolved, and this is a current representation of that perspective. Microsoft and our partner community, including Mazik, has spent a lot of time and investment helping our government customers address these problems via a variety of solutions, including things like COVID test registration, contact tracing, and even unemployment insurance scaling needs. And though those kinds of solution demands continue, many people are now focused on vaccine-related needs and assuming successful immunization, ultimately back to work activities. In today's session, we're focusing on vaccine registration because that's top of mind for governments and other customers, and certainly for us here at Microsoft and Mazik. Next slide, please. Before COVID, most vaccines were handled via individual initiated medical provider visits, like any of us going to our primary care physician, perhaps to get a flu vaccine. And after that vaccination, data was collected, managed, and reported via something called a state immunization information system. However, with COVID, immunizations require new capabilities previously not available in those systems, nor in most healthcare provider systems or other institutions. These capabilities include things like registering people for vaccines, scheduling their second immunizations when those are required, and tracking adverse reactions. Mazik's VaccineFlow solution provides all these capabilities and more. And let's talk a little bit more about that. So next slide, please. This shows guiding principles for health emergency response systems. I think most of you would probably agree that these are critical characteristics for COVID-related systems. And to realize these guiding principles, we see a growing number of customers modernizing their systems via platforms like Microsoft Dynamics and our Power Platform. And it's probably not surprising that this is occurring in the COVID solution marketplace too. Platform-based COVID solutions are relevant not only for our government customers that I focus on, but also, well, and Mazik's customers like Denton County, Texas, and educational institutions like Vanderbilt University, another of Mazik's customers, also healthcare providers and related businesses. We're really pleased that Mazik followed this pattern too, offering their VaccineFlow on this Power Platform. And in a moment, Peter's going to tell you how the solution evolved. And I think you'll see that it followed the same sort of COVID-19 response pattern that I described a moment ago. Then after that, Amy's going to provide us a demonstration of VaccineFlow, and then we'll close with the question and answer solution that Peggy mentioned earlier. So Peter, the floor is yours.
Thank you, Andy. I really appreciate the opportunity. I appreciate working with Microsoft to have that power of the platform is extremely important for us all. What I'd like to talk to you a little bit about is what we're doing here with VaccineFlow and give you a little bit of background on Mazik Global. We have been in the Microsoft ecosystem for over 18 years. We were founded by three gentlemen who came from Microsoft deep in their development organization prior to that. What we're most proud of is the fact that we're in part of Microsoft's inner circle for the last 3 years, which is reserved for the top 2 to 3% of all Microsoft partners. So you think of the Microsoft ecosystem, that is who we are. That's on the left-hand side. On the right-hand side, this is really, really important, which is the depth of experience and the stories we have from a lot of our customers. Take, for example, Adventus Health in the upper left-hand corner of our customers. What originally started out as a platform and solution to help them vaccinate their 40,000 employees is looking to expand beyond that in order to track all their employees' health. Vanderbilt University had the need to get their students back on campus to continue a normal life and education. They've further expanded that out and have gone live with the vaccination tracking. And some of our technical folks are on the line here today. Really appreciate them doing that and doing that rather rapidly. So thank you very, very much. Hats off to you. And Denton County, Texas, which we'll talk about a little bit further as well. They're vaccinating 10,000 people a day. Very excited about that opportunity that's down there and how they're leveraging the platform to expand it further. Let's go to the next slide so we can go a little bit more in depth. This is really important. Me personally, as an individual, I came from outside the Microsoft ecosystem, but once I understood the power of the platform, which is presented here today, you'll understand the importance of what the flexibility and how rapidly we were able to deploy solutions into the marketplace to actually help us all get vaccinated. And what we've done is we've taken the platform that you see and expanded upon it with the MazikCare IP. So this is what we're representing here. You take the normal dynamics, power apps, business intelligence, layer on top of that our know-how from healthcare as well as our know-how from the public sector, and that creates an extremely powerful solution that we've been able to deliver. So what do I mean by our know-how? This is the broad depth of the MazikCare experience. We look at dynamics in the Power Platform, and over the last 7 or 8 years, we've actually developed MazikCare. When COVID-19 hit a year ago, we had to change directions and understand what is it we can bring to the marketplace to actually help individuals move forward. While this is not our COVID-19 solution, this is the broad depth that we bring to the marketplace for individuals and counties. So let's focus in a little bit more on what exactly our COVID-19 vaccine management solution is. We'll start on the left and move to the right. Initially, what we needed to do is get an understanding of who's eligible for the vaccine, as this is constantly changing with CDC requirements and on a state-by-state basis. So on the left-hand side of the screen, we were able to develop the vaccination ability to schedule individuals and understand who those individuals are as they're coming in. As we move across, we reach out to those individuals when they're scheduled, sending them a QR code so that way they can come in, we have their information, and effectively get them in for the vaccine. I know personally in my own county, this didn't happen. And individuals, when I had to take my own parents to get vaccinated, had a line, had to wait 45 minutes in line just to get vaccinated. And these were elderly individuals. So this is what we're trying to avoid, efficiently get patients and citizens into vaccine and get them out. As we continue to move on, we have the ability to monitor individuals and understand what types of reactions they may have. More specifically to the county and public sector, the ability to have an inventory management process, and then on the back end side, track that through the Dynamics platform and understand through business intelligence where the vaccinations have taken place and how many folks have been vaccinated. So that's the broad depth of the focus of the platform that we bring to the table. Specifically, one of our customers is Denton County, Texas. We originally approached Denton County and came to them just before the end of the year. We started the project on January the 4th, and we went live about 4 weeks later. This is an example of the Texas Motor Speedway, in which they're vaccinating 10,000 people a day. The success of this particular project has even caught the ear and the eye of the White House and how we can mass vaccinate our population. And this is really what we're trying to achieve. It's about applying the technology to the problem at hand in order to create a rapid solution. And this is done through the Microsoft Power Apps and Dynamics platform and can be done in a rapid fashion. I'm going to go ahead and pause there and pass it over to Amy.
Sorry about that, guys, talking on mute. Thanks, Peter. So good afternoon, everyone. Let's get started. The MazikCare VaccineFlow solution facilitates the complete patient vaccination journey with its self-service guided scheduling, adverse reaction reporting, and effective monitoring. It centers around 3 key types of users: the vaccine administrator, the patient, and the employee. Today, we are going to take a citizen through the vaccine flow from registration to vaccine complete. Here we have Jenny Smith, a Phase 1B citizen, and she is registering for the vaccine via the portal. So here we have the portal. It's currently branded as Mazik, but every county or hospital can apply their own branding. From here, you can do a provider registration, find a provider, report an action, or check vaccine eligibility. Jenny Smith is going to make an appointment, so she's going to click here in the middle of the portal page. Making an appointment is generally a 2-step process. Register an initial eligibility check, and then making the appointment. So Jenny's here to click on this. She's going to enter some basic information and any special accommodations. She will then go through the eligibility check and answer a few questions, and then she will accept consent. So once she submits that, it'll let her know if she can register. So what happened in this scenario is it's more of a pre-register. So Phase 1B wasn't her time for Phase 1B yet. So what we're going to do is move on, and she's going to get an email that states, hey, now it's Phase 1B's time, and you can go on to the portal and finish your registration and set up your appointment. So Jenny received her email. She's saying she's eligible, and there's now appointments available for her. She will click this link here in the middle where it says click here. It's going to take her into the portal. It'll take her into the portal to verify her date of birth. This portal is accessible via your desktop and mobile with a mobile-friendly view. The link is specific to Jenny and cannot be forwarded, so it's unique to the individual. So let's enter our birth date, Jenny's birth date, for verification, and then click verify. This will take you through a more comprehensive eligibility check. These are standard questions based on CDC and state guidelines and configurable if phase eligibility guidelines change. These answers will help determine whether you can make an appointment now or not. So let's go through these questions. There are about 12 standard questions. Again, these can be configured on the back side, and I'll show you some of that here at the end, but let's just answer these 12. So, are you approved or received it? Do you want to? Do you have any history of allergic reactions? Have you received another vaccination? Are you under 16? Have you tested positive for COVID? Any exposure to someone with COVID? So it's going to go through, and again, these are pretty standard, but they can be configured. So we answer a couple more here. checking if you're immunocompromised. And if you have any history of severe allergic reactions. So now you'll be, if you're eligible, you will be presented with a consent form. This message is also configurable and can be catered to your needs during implementation. You will need to check the box to consent and then click the submit button. Once you consent, you will be presented with a list of available appointment locations. It will only show locations with available appointments. So if Baltimore County doesn't have any appointments, it will not show in this list. So let's look at Baltimore County as an example. It's showing 4 available dates. Again, these are 4 available dates that have available time slots. So let's pick a date. We'll pick 3/18. And now you can choose from available times that work best for you. Let's pick 7. And then click next. You will be presented with a page to double check the location and date and time you chose. And then click book. Then you're presented with this confirmation page. It has your name, your birth date, the date and the time, the clinic location, your QR code, your confirmation number, and any special notes or instructions. This confirmation will be sent to your specified email and texted to your mobile number. You have the ability to define the messaging that is presented in these forms as part of the implementation process. Saving the confirmation with the QR code will streamline the patient process in the next step at the vaccination center. So it's really helpful if you keep this email either as a text message or just as an email so that you can show it. It really will speed up the process, but either way, the next process is pretty speedy. Also from here, you can look at patient details up in the navigation and your vaccination summary. You can review, edit, or update the patient details. And the vaccination summary will show you all your vaccine appointments. So if you've already had your first dose completed, it will also display here. So let's look at the patient details. You can update if needed, then confirm and submit. That will take you to the vaccination summary. As mentioned, if you had already had your first dose, it would show here. You can also choose to cancel or reschedule your appointment. If you click on the cancel reschedule button and you can click to acknowledge that you would like to cancel your upcoming appointment or just to be removed from the vaccination list. If you choose to cancel, you would have to return to the available appointment page to choose a new date and time. In this case, Jenny chose to keep her appointment. So now, Jenny Smith has booked her appointment. She chose to keep it. She didn't cancel, and she is arriving at the vaccine station to receive her vaccine. So let's review the mobile app for vaccine administration. As a vaccine administrator, I can see all the locations where I'm authorized to administer the vaccine. I can also search for those locations in the search window at the top. If you have, pages and pages of locations where you are authorized. Today, let's choose Baltimore County as an example. And you can see all of the appointments that are booked for today. You can search for a patient by name or confirmation number. If the patient comes with their confirmation email, you can also scan their QR code and it will automatically display the information. So let's scan for Jenny Smith. So it's loaded the patient information. It's got their date and time of their appointment, their birthday, their address, etc. At this point, you can also add any station notes. For instance, here, Jenny Smith mentioned her zip code was incorrect. So we're noting that. But you can add anything else that comes up that the patient notes during their appointment. And then we're going to change Jenny's status to checked in. So now we're going to switch the view from the top from booked to checked in, and we will see Jenny Smith in the check-in queue. If there's a different person managing this station, they can scan Jenny's QR code again, and it will take them to the checked in details. From here, you can review the information submitted by the patient during the registration process, patient history, and eligibility questions, helping to simplify the process, the distribution process. Here you see all of Jenny's questions and responses. And if there's anything you feel like you need to discuss with the patient at this point, based on these responses, you can do so at this time. So now we're going to click Next. And we're going to enter Jenny's vaccination details. They can be entered manually, or you can scan the QR code on the Pfizer or Moderna box, and it will automatically fill in the details, or J&J box. It will automatically fill in the details. Manufacturer, lot number, expiration. You can also, at this point, you would also fill if the administration route, the administration site, and the vaccination status. We're saying vaccination is complete. It's a very simple process to scan the QR code from the box and complete the vaccination and to move on to the next step in the process. So we've hit submit. Now we're going to switch to the view to complete. We see Jenny has received her first dose and she's sitting in observation. We will open the record and we can set if observation is complete at this point or report an adverse reaction. For now, we're going to say her observation is complete and she didn't have any adverse reactions. This completes the process of Jenny receiving her first dose of the vaccination. She's all done. Quick, easy, simple. So at this point, I'd like to jump over and show you guys the back-end administration. There we go. So on the back end, this is where you set up a lot of your data when you are when you get started and you're ready to go. We can import it through different data imports. You can also set it up manually. But first I want to start with, there's some dashboards that are in the system. So there's some that are out of the box here that you can get: vaccination summaries, appointment summaries. I'm on the response dashboard. There's some overviews, vaccines in the last 7 days. So these are configurable. You can configure these, you can build your own. It's very easy to do and it can be part of your implementation. Over here on the side, this is where you would set up your providers. You would set up your manufacturer. So we have Pfizer and Moderna in here. You would add, Johnson & Johnson and any other manufacturers that as they get approved, you can come in and add them in here. You can add your suppliers. You can also add practitioners. You can add your patients. So you can see, like we were working with Jenny. There she is. She's in the system. She's an active patient. You can add your vaccination types. So like I mentioned, this is where you would add Johnson & Johnson. Let's just open one of these up. So you can see, you would put in their name, you put the manufacturer, you put the minimum days and maximum days between doses in, you put the number of doses. So Pfizer and Moderna were both 2. For J&J, you would put 1. And you can also put a consent, the text for your consent message in here as well. You can come in and set up all of your vaccination stations or centers or locations. This is set for all the state of Maryland, but you specify it to your needs. And you can set up these vaccination stations, we have the streets, and some different details in here. Let me take a look. You can say whether the station is administering first dose, second dose, or both. You can specify that. You can say what types of emails will get sent based on this station. So there's a lot you can do around configuration of the stations. You can also configure the phases. So like we saw in the demo, the Jenny Smith wasn't, she was phase 1B, and phase 1B wasn't eligible yet, even though she was registering on the site. I know I run into that myself, right? I basically pre-registered with the state of Florida, right? So I do that, and then when my phase is eligible, then I will get an email like she did, and I will be able to go out and finish the registration and schedule an appointment. So you will do that here, and the system it puts those checks and balances in place. You can also look at vaccinated contacts here, any contact refusals, if anyone refused their vaccine, the adverse reaction log, whoever's been reporting any adverse reactions, that's all in here, easy to get to, easy to report on. And you can do appointment generations, and you can come in and let's just pick a new appointment generation. I'm just going to walk through one of these. So when you would set one up, you do it per station, and you would say, and per vaccination type. So you would say we got 30 vaccine doses of Pfizer coming in. Our appointments are 10 minutes long. Our appointments are 20 minutes long. Our appointments are 30 minutes long. You can specify that here, 15. You can say number of slots. So you can, as you saw in that Denton County photo from before on the other slide, they had multiple lanes of vaccines going. So you can specify 1, you can specify 10. So you would enter your appointments, your number of slots or lanes you have going, and the number of vaccine doses that you received. And then you would say, I want to do it on this day. And I want the start date and the end date and the time from there and there. So if this was 3 to 11 p.m. You would also fill in some of the other information here. Most importantly, the vaccine center that you're trying to set up the appointments for. And then you would save and you would generate appointments, and they're going to generate in the background. What's nice is if, like, let's say you're anticipating 30 doses, but you only get 20, you would come down here and you would say, we only received 20. You could save and regenerate and update the vaccine appointments, and it'll take 10 appointments off, let's say, because you're short 10 doses. So then those appointments won't be available for people to accidentally book, and then they show up and there's no doses. So that's a nice feature. You can come in, update that, and then it'll remove those from there, knowing that you would receive less doses. So, and one more thing I'd like to take a look at are the assessments. So in here, we've got an eligibility check and an adverse reaction assessment. So this is where you would configure your assessment and your questions. So you can come in here real easy, and it's like, let's look at 16. So You can say, yes, are you under the age of 16? Yes. Then, if you are, then you're not eligible, right? Or if you're under the age of 16, or no, then you are eligible, right? So then you would flip this toggle. So you can control the eligibility in here based on per answer per question. So it's highly configurable. You can add more assessments, you can add different questions, you can remove questions as you keep going along, through these phases and as guidelines change. Okay, Sue or Peggy, I'm turning it over to you guys for questions.
Okay, excellent. Thank you so much, Amy, and thank you, Peter, and thank you, Andy. I don't see any questions yet in the chat, but we did have a few questions submitted in advance, so I will take them one by one if that's all right, and the panel can jump in to field the questions appropriately. One of the questions that came in is that if a county or government entity does not need the full solution, as Peter showed on the slide of left to right, can they just grab one of those modules, and how does that fit in to the solution that they may already be running?
The answer is absolutely. It's really about finding the right module that fills the gap that you have. So we can break it down into each individual piece that you need, fill in the gap to make your process more efficient. So absolutely.
Okay. Excellent, excellent. Is there any information that can be shared about how the data is protected from a privacy standpoint, and then also state reporting requirements of what % of your population is vaccinated, what % isn't, and things along those lines?
So from a data privacy, that's the other reason why I think, and I'll let Andy also comment on this, that the power of the Microsoft platform and the Azure cloud, the fact that it's FedRAMP compliant, the fact that it's HIPAA compliant are extremely important. Plus that this is your tenant that it is residing on, so you have complete control of the data and information. Then the power of having that data and information available to you, you then apply the business analytics to that to understand what is happening within your population. That creates a much more efficient reporting process and a deeper understanding of where the needs are. So for example, I think one of the biggest concerns is, are we finding and delivering the vaccine to underserved populations? Well, the only way you can get to that answer is if you have the data available to you.
I think Peter said it perfectly. The only thing I'll add is if you have curiosity about the different sorts of compliances that we offer for our cloud, I would encourage you to go to the Microsoft Trust Center, and we can provide a link to that, and it will show you the specifics of the capabilities that Peter was speaking of.
Amy, have a question. Oh, sorry, Andy.
But that was it.
Oh, okay, Amy, have a question for you. You had showed in the sandbox how someone can adjust if they were expecting 30 doses and they only received 20 or whatever the number would be that would be adjusted. If there were people already booked against those doses that were expected, is the system capable of generating an automatic email or communication to the person to let them know, hey, we need to change your appointment, click here to finalize that? Is there any type of feature or an add-on ability around that?
Yes, we can configure a flow that would let people know if they were to have booked those appointments in that scenario. Also if, for some reason, like I see there's a question around if they're not all administered, you could always set up new appointments, go and generate new appointments for, the remaining doses as well.
Excellent, thank you. And if there is a question posted in the chat, someone just please jump in to read that out. My monitor's on presenter mode, so I can't see the full chat right now. But I do have another question. Oh, go ahead.
Well, I was going to say the question regarding blockchain is we're not using blockchain at this point in time. And the next question was with how the rate of technology adoption in Denton County. It was very, very rapid. As I said, we were live within about 3.5, 4 weeks and fully functional now we're at the end of March. So they have been vaccinating 10,000 people a day. since roughly the 25th of January. So if you do the math on that, that's a pretty good rate of the adoption of the technology.
Question, I think probably this might land in your court a little bit, Amy, but regarding folks that have gotten their vaccination from another place before coming to the location that they're looking at now, the system does show the question, have you been vaccinated before? If someone clicks yes, what does their experience look like? Do they then not, are they not eligible? Is it up to the administrator who's setting it up how to handle that? Or is it simply they can move ahead and still get vaccinated? What does that experience look like from a user side and also from the sandbox side of setting it up?
Yeah, so you could configure that those assessment questions to take them if like you're allowing if your vaccination center, because I think everyone probably might be a little different, right? If they're allowing people that are coming in from other places, maybe that have gotten their first dose someplace else and they're getting their second dose. I know states and even counties maybe have different guidelines around that. So we could configure like that question to be like, if they answered yes, I did receive my first dose already, and then we can add some follow-up questions in the assessment engine to determine what to do next, depending on your guidelines.
Nice, thank you. I heard a buzz. Was there another question posted?
There's a question about, does it auto schedule move people ahead, pre-registered patients, if others don't show up? And Amy, you can correct me, but I think that's again the power of the flow technology is that you can create a flow that will alert people should spaces show up. And that really kind of answers another question, which is, let's make sure we're using these doses so that way they don't go into spoilage. You know, I think the government has ordered almost 200 million doses at this point in time across the 3 or 4 different vaccines that are out there. So, you know, we really do want to utilize it appropriately. So that's the power of the flow. And then, of course, I always go back to it's about the data and making sure we understand the citizens that are in the system.
Perfect. And actually sticking in that line regarding inventory and doses that are on hand, how does the platform support? Does it exist? Can it be built out for you to be able to track what you have centralized, ambient temperature, cold storage temperature versus satellite areas that you may be having some of the doses allocated based on if you have a large county and you have them dispersed in different locations? Does VaccineFlow support kind of that measure?
Yes, and that really gets deeper into going beyond the Power Apps platform, beyond the flow, and actually leveraging the functionality of the full D365 F&O platform. And we're bringing in the MazikCare capability to track and trace that through the full supply chain. And what we have found that in the county governments and the county health administrations, they don't have that full supply chain that would be normally be in, say, a healthcare provider format. So that is something that where you're really getting to the broader application of the MazikCare and Dynamics platform.
Thank you. All right. So that wrapped up the questions that had been sent in advance. We're running a little bit ahead of schedule, so just want to do a quick round. If anybody has any questions that's on the call, you want to type them or take yourself off mute to ask them, or if there's any parting questions or comments from any of our panelists, we have some time for that.
Looks like there's an additional question with regard to, does it integrate with e-health systems? Just to answer that question with regard to integration, there's a couple different ways this is done. I guess it's just health systems. So there is integration via HL7 and FHIR that can be done to EMRs and EHRs that are in the marketplace, depending on what version that they are out there. Also, depending on where folks are in the country, a lot of this has to then be reported back into the state vaccination registry. So that is also possible as well. What we're finding is most of this is HL7 driven at the state vaccination registry level.
Excellent. All right. If there aren't any last questions, Peggy, I'll turn it over to you to do a wrap up if that's okay.
Yeah, sounds great. So I have posted a link to a survey in the chat window, and we do really, really appreciate your feedback. We definitely take the time to read it and act upon it. So please, if everybody could take a moment to fill that out, note that link. Also, I would like to mention that the attendees and registrants can access the recording as well as the deck on the registration page. You'll receive an email notification as soon as those are both available, and it's usually within 24 hours. So that does wrap up this presentation. I'd like to extend a big thank you to our partners over at Mazik Global, as well as Microsoft, and our attendees for joining. Have a great day or evening wherever you are, and stay safe.